My name is Siobhan, and I am one of the clinical pharmacists that work in the surgical team at Glasgow Royal Infirmary. Pharmacists are here to support you during your surgical journey by making sure that your medicines are safe and that they work effectively. This is important because it can help reduce the risk of complications from your surgery and can reduce how long you may need to stay in hospital. Before you come for surgery, a list of any regular medicines that you take and any allergies you may have will be checked with both your GP practice and yourself. Please make sure that you order enough supply of your regular medications from your GP and chemist for when you are discharged. Depending on the type of medicines that you take, a pharmacist may contact you. Sometimes we need to stop certain medicines, and sometimes we also need to increase or reduce the doses of your medicines before surgery. An example of this could be if you take medicines for high blood pressure. Because everyone is different, it is important that we make an individual plan for you and agree on this together. This review will take place either face-to-face or by phone call before you come to hospital. Before your surgery, an anaesthetic doctor will talk to you about your medicines and discuss a plan for the medicines that you will get to make you sleepy and to give you pain relief. This plan will be made to suit you, as everyone is different and has individual needs and preferences. After your surgery, a pharmacist will review your medicines to make sure that they are still safe for you and in the best formulation for you to take. Sometimes after surgery, patients are not able to take their medicines by mouth. A pharmacist can suggest alternative ways to take these medicines to avoid missing any doses of essential treatment. If we know in advance that this problem is likely to happen, this can be discussed with you before surgery so that you know what to expect and you are involved. The most common symptoms that you may have after surgery are pain or feeling sick. The pharmacists work alongside other members of your healthcare team to make sure that these symptoms are managed with appropriate medicines that are safe to take alongside any of your regular medicines. After certain surgeries, it is recommended that patients take an anti-clotting medicine for 4 weeks. This helps to prevent blood clots forming, which may be a possible complication from your surgery. This medicine is called enoxaparin, and it is an injection using a pre-filled syringe into the abdomen. It has a small needle that inserts just below the skin, similar to an insulin injection taken by people with diabetes. The nurse will show you how to inject this medicine at home, and you can practice this on the ward with the nurses. The injections will be supplied to you from the hospital pharmacy when you are discharged from hospital, along with any other new medicines that you require. The hospital pharmacist will speak to your community pharmacist if you need help with any of the medicines when you go home. If you have any questions about your medicines, please ask to speak to a pharmacist who will be happy to answer your concerns.